Assalamu alaikum, I'm Dr. Ansari. Through this campaign, we aim to highlight why tobacco use must be addressed not only medically but also strongly within dental care. We often ask, why is anti smoking a dental issue? The answer lies in our unique position as clinicians. Smoking damages oral tissues, but dentists are the first line of defense. We have the ability to detect the early signs of damage. Our routine exams provide a perfect window for screening, counseling, and referrals. By addressing tobacco status at every checkup and integrating brief interventions into our clinical workflow, we don't just fix teeth, we support broader community health goals. The mouth is a truly window to the body. When we look to the damage caused by smoking, the list is severe. It accelerates gum disease, attacking the very tissue that holds our smiles together. Beyond that, we see significant tooth discoloration and a skyrocketing risk of cavities. But most critically, smoking greatly increases the likelihood of oral malignancies. The risk of oral cancer doesn't just rise, it skyrockets. As we can see here, the reality of tobacco use is not abstract. From staining and decay to severe tissue destruction and carcinomas, these images remind us why our intervention is not just optional, it is a medical necessity. So, why must dentists lead this campaign? We have the clinical reach, the credibility, and the systems in place to move patients from detection to sustained cessation. It works in a cycle: detection, counseling, and follow up. Because we see patients for routine exams, we can identify oral signs early through repeated contact. These repeated visits enable us to systematically follow up, capture data, and prevent relapse. We call this approach quick moments. We are harnessing dental visits as intervention points. Our methodology creates a patient funnel using badges and toolkit leaflets. It connects routine dental care to tobacco cessation support in three clear steps. We screen visually, we prompt clinically, and we refer rapidly for the highest impact. Let's break down the patient journey. It starts at intake. We capture tobacco status at registration and display our risk badge in the patient's record. Next is the screening. We ask about tobacco use and oral symptoms, recording their risk level. Then we move to the intervention. We deliver a brief 1 to 3 minute scripted advice session. From there, we provide a referral pathway to cessation services. And finally, follow up. We confirm their engagement with the service and track outcomes in their record. To make this work, we have developed a clinic ready campaign. This involves targeted communications to increase referrals. We are launching a digital clinic with automated reminders and QR coded leaflets. We are utilizing social video short 60-second educational clips highlighting the oral effects of smoking. And for our professionals, we are offering inter-university webinars and shared toolkits to ensure consistent clinical messaging. Our expected impact is to completely shift the patient journey. We are moving from passive treatment to active, earlier detection, and sustained cessation support. We view this as a bridge of care connecting detection to long term health. It is a ladder of patient progress, moving them step by step from screening to support uptake. To ensure this program lasts, we are implementing 6 practical process metrics for measurement and sustainability. First, we ensure tobacco status is recorded in the EMR template field at every visit. Second, we confirm that brief interventions are delivered by documenting short counseling in visit notes. Third, we track that follow ups are completed, monitoring calls or appointments. Fourth, we provided data capture guidance using structured fields to minimize free text. Fifth, we enforce governance actions such as annual staff refreshers and checklist. Finally, we have a clear reporting approach, starting with qualitative reports and shifting to routine monitoring as our capacity grows. We are asking you today to commit to a quick moments pilot through 6 decisive actions. First, we need a one-line call to action to officially endorse the campaign. This endorsement leads to first pilot adoption, where we implement quick moments across participating dental hospitals. Second involves training time, allocating dedicated staff hours for protocol delivery. Third is a short evaluation supporting a defined assessment of our outcomes. We also require management actions to appoint a clinical lead and approve starter materials. Lastly, we will ensure a strong visual close with bold headlines and campaign branding to unify our message. Together, we can turn routine checkups into life saving interventions. Thank you for your time and your commitment to protecting smiles.